Today we will be doing a presentation on balance and fall prevention. First off, what is balance? It's the ability to control your body in an upright position, either stationary or moving. The balance system consists of three components: vestibular, visual, and somatosensory, or also known as proprioceptive. The sensory information is provided by the vestibular system, which is located in the ear. These consist of motion, equilibrium, or spatial orientation. There are three components to the ear: the utricle, the saccule, and three semilunar or semicircular canals. The utricle and the saccule detect gravity and linear movement, while the semicircular canals detect rotational movement. For an example, when the head rotates, the endolymphatic fluid lags behind due to inertia. This exerts a pressure against the canal's sensory receptors, which then send impulses to the brain, detecting movement. The next component is vision. The sensory receptors in the retina are called rods and cones. Rods help vision in low light, such as during night, and cones are for color vision and for very fine details. The responsibilities of rods and cones are to send impulses to the brain that provide visual cues relating to orientation, which happens when light strikes them. The last component is somatosensory, also known as proprioceptive. This consists of skin, muscles, and joints, which contain the sensory receptors. These are very sensitive to stretch and pressure within the tissues. When an individual is standing and leans forward, the sensory receptors send impulses to the brain. The stretch and pressure cues help the brain determine where the body is within its own space. This is a diagram that further explains these three components. So within the vestibular system, it determines things like equilibrium, spatial awareness, rotation, and linear movement. Visual is sight, and proprioceptive is touch. All three of these components go to the cerebellum, which coordinates and regulates posture, movement, and balance. They also go to the cerebral cortex, which contributes higher level thinking and memory, and also the brainstem, which helps with sensory information. Then from these three locations, they go to the motor input, such as the vestibulo-ocular reflex, and also motor impulses that control eye movements, and motor impulses to make postural adjustments. From these three motor inputs, they all help determine how well one is balanced. There are two types of balance, such as static and dynamic. With static balance, it's balancing in one place without movement, such as standing in place. And dynamic balance is balancing with movement, such as walking, running, or reaching. There are several factors that affect balance. It can be things such as the loss of muscle strength or decreased joint and muscle flexibility, and both of these happen with an increase in age. Then decreased sensory capabilities. This comes with changes in vision, hearing, taste, and vestibular function. Neurological conditions can affect balance, and this can come with stroke, Parkinson's, or dementia. Arthritic conditions, such as weakening muscles, joints, and bones. Also postural hypotension, which is when the blood pressure lowers when one is standing or stands up. And also medications can affect balance and also cause confusion or dizziness.
An important thing to remember is that falls are preventable. Falls that cause serious injuries are not a normal part of aging. A general rule of thumb is that if you take care of your overall health, you may be able to lower your chances of falling. While your risk for falling increases as you age, it's really only considered a significant risk when it's paired with other risk factors for falling. And I've got a couple of them on the screen here. So these are for the four like more common risk factors for falling, and I'll just kind of go through them. So the first one is trouble with walking or balancing on your own. In this case, assistive devices such as canes and walkers are helpful to kind of reduce that risk of falling. And when applicable, you should kind of have you could have someone walking with you, such as an aide or a nurse or a family member, just to have another person there to ensure your safety. Next, we've got poor eyesight. So when you have trouble seeing, it's gonna make it harder to see where you're going. So if you wear glasses or contacts, make sure you're wearing those and that you can see. You could keep the lights on to make sure you can kind of see your path and where you're headed. Next, we have multiple medications. So any medication that you're taking will have an effect will have some kind of reaction in your body. And the more medications you're taking, the more likely they're going to interact with one another inside of your body. And these interactions could have an effect on your balance and coordination, and it could increase your risk of falling. So, just being aware of the different medications you're taking and the effects that it might have. Lastly, for these four, we have tripping hazards. So having physical objects on the floor around you are going to increase your risk of falling and like tripping on them. So something that you can do is you can just like tidy up a little bit and kind of reduce that risk. And all of those will kind of reduce your risk of falling. So there is good news here. You can, even if you have risk factors towards increased falling as you age, there's something that you can do to make each risk factor a little smaller. So in relation to the four most common risk factors on the previous slide that I just talked about, here are some simple steps and tips you can take to prevent falling and reduce that risk. So first of all, there's exercises that are aimed at improving your balance and postural strength, which are very important in decreasing your trouble with walking or balance. And these exercises are simple to do at home. They're low impact. We'll go through a couple examples in the next few slides. And then we have medications. So like I mentioned, especially if you're taking multiple medications, they're going to have an interaction in your body. So that one thing you can do is have a conversation with your doctor about your medications and the possible side effects of their interactions. Then we have having your eyes and feet checked regularly. So physical problems with your eyes and feet are going to increase your chances of falling. It's important to have them checked regularly to make sure you're aware of the state of your eyes and your feet. And then lastly, you should remember to stand up slowly. So especially after you've been sitting for a while, when you move from a lying to a sitting position, or even from sitting to standing, there's a chance that your blood pressure could drop too low. And when your blood pressure gets too low, it'll cause some people to feel dizzy or unstable. And those feelings of dizziness will increase your chances of falling. So once you're standing and you're steady enough to walk, remember to keep a steady, comfortable pace. Don't try to move too quickly, because trying to move too quickly and be in a hurry will just increase your chances of falling. So just remember that slow and steady wins the race. And then lastly here, this image is just kind of restating some of the important points that I made on the previous two slides. So we've got check to see your medications can make you susceptible to falling, have that conversation with your doctor. Just so, even if you can't change your medications, just so that you're aware of the medications you're taking and the risks that they pose on your balance and coordination and your risk of falling. You should remember to stand up slowly. Don't try and move too fast. Moving too fast just causes issues. Just take it at a slow, comfortable pace. Take your time. If you feel dizzy, make sure you sit down. Don't rush anything. You should see your doctor to make sure that you don't have any conditions that could put you at risk for falling. So any other mental or physical conditions that might increase your risk, make sure you have another conversation with your doctor. Again, there's exercises that could help improve your strength and your balance, which we'll go over here shortly. Wear proper footwear. I didn't talk about that one, so just to elaborate a little, you should always wear the right shoes. Try to avoid things like slippers, open-toed shoes, slippery soled shoes. They're just going to increase your risk of falling because they won't have good traction on the floor. Most people find tennis shoes work well. So just remember that you want a shoe that fits well, supports your feet, and has non-slip soles. And then lastly, make your home as safe as possible. So like to avoid any tripping hazards, try to keep your areas clean, especially areas that you walk in a lot. You should avoid storing any objects on the floors. If you have rugs on the floor, make sure the rugs are secured by using something like an adhesive like tape. You should make use of grab bars and railings whenever you can, like in the bathroom or in this walking up the stairs. And then another tip is to place objects that you use frequently in easy to reach places. Don't put them on the ground and then having to bend over to get them will increase your risk of falling. Don't store them too high because having to get on like a step stool is going to increase your risk of falling because of your reduced balance and like unsteadiness. So just remember to kind of declutter your common walking areas and things you use often to put them in an easy place to grab so that you don't have to worry about trying too hard to reach them.
To prevent falling, you can implement 2 things into your activities of daily living that work on balance and strength training. The following exercises are for those who are low risk to a fall and are able to stand without the help from others. The sit to stand exercise and the balance exercise builds leg strength while improving body mechanics and balance, which are all important in reducing falls. To do the sit to stand exercise, start by sitting on a sturdy chair of standard height and make sure that it won't slide or roll. You should be able to sit comfortably with your feet flat on the ground. Have a sturdy support surface in front of you, such as a countertop, so that you can reach to it for support if you start to feel unsteady when standing. Scoot forward so that your glutes are positioned at the front of your seat. Lean your chest forward over your toes, shifting your body weight forward. Squeeze your glutes and slowly rise to a stable standing position. If necessary, place your hands on the arm or seat of the chair and push through your hands to help stand and sit. The goal is to not use your hands at all. Perform 10 repetitions twice a day. For an advanced version, hold hand weights to add resistance. If you have pain in your knees, back, or hips, discontinue and talk to your doctor or physical therapist. The series of balance exercises helps you balance if you are unsteady. Make sure that you have someone with you in case that you lose balance. To begin, stand in a corner or have a kitchen counter in front of you to reach out to in case you start losing your balance. To do the feet apart version, stand with feet about shoulder width apart, your eyes open, and hold steady for 10 seconds, working your way up to 30 seconds. If you find yourself swaying or reaching for the wall or counter frequently, Just keep working on this exercise until you can do it with minimal swaying or support. Once you can hold this position firmly for 30 seconds, move on to the next exercise, which is doing it with your feet together. Stand with your feet together, eyes open, and hold steady for 10 seconds, working your way up to 30 seconds. Once you can do this exercise with minimal swaying or support, move on to the next one, which is doing it on one foot. Stand on one foot with your eyes open, hold steady for 10 seconds, working up to 30 seconds. Switch to your other foot after that. Then you can do it with your eyes closed. So if you can perform the first 3 exercises safely and with little support, try to do each one with your eyes closed. Hold for 10 seconds, working up to 30 seconds. Falls to the side of your body with impact to your hips have a higher incidence of fracture. Development of hip abductors and leg extensors related to lateral stability help improve lateral postural stability, which would help reduce the falls to your side. One of the exercises that you can do to increase this musculature is called the side abduction. To do this, lie down on the floor on your side and rest your head on your arm. Keep your feet together and lift your top leg up so that your knees are separated and keep your hips steady. Slowly lower your leg back down. Repeat 10 times and then switch sides. The second exercise that you can do is called clamshells. To do this, lie on your side with your legs stacked and your knees bent at a 45-degree angle. Rest your head on your lower arm and use your top arm to steady your frame. Be sure that your hips are stacked on top of one another, as there's a tendency for the hips to rock back and forth. Engage your abdominals by pulling your belly button in, as this will help stabilize your spine and pelvis. Keeping your feet touching, raise your upper knee as high as you can without shifting your hips or pelvis. Don't move your lower leg off the floor. Pause and then return your upper leg to the starting position on the ground. Do 10 reps on each side.
Okay, now we're going to shift gears and talk about who is at risk for falls, why you should want to prevent falls, and age-related risks with falls. So, who is at risk? 20 to 30% of older individuals who fall suffer moderate to severe injuries. These injuries could be anywhere from bruising to hip fractures to even head traumas. Males actually have a higher chance of having a fatal fall versus females are more prone to falls with an increased chance of severe injury. Some additional risk factors that could potentially increase the likelihood of a fall occurring are alcohol or substance abuse, overcrowded housing, underlying medical conditions such as cardiac or neurological problems, certain medication side effects such as impaired vision or balance problems, and overall poor mobility, cognition, and or vision. So why should you want to prevent falls? A huge reason why preventing falls are important is because over 95% of hip fractures are due to falls. And we all know that hip fractures are painful and take a long time to recover from. 684,000 fatal falls occur each year, making it the second leading cause of unintentional injury, second to car accidents. Most falls are not fatal. However, for every 1 death due to a fall, there are 4 cases of permanent disabilities, 13 additional cases requiring hospitalization for over 10 days, and another 24 cases requiring hospital stays under 10 days. On top of that, there are reported 690 more cases that are affected by falls that need some form of medical attention and or potentially miss work. Every year, 37.3 million falls are severe enough to require medical attention. So the increase in fall risk associated with age. So unfortunately, the statistics show as you age, there's an increased fall risk. However, we can prevent those, like we talked about earlier. 30% of people 65 and older fall each year. 50% of people 80 years or older fall each year. Over 1/3 of individuals over the age of 5 have experienced at least one fall in their entire lifetime. And our goal is to bring this statistic way down. So in summary, balance is the ability to control your body in an upright position. Falls are preventable, and 1/3 of people over the age of 65 have fallen in their lifetime. There are a number of different exercises an individual can perform to help prevent falls and improve their balance. Overall, we just want you to stay active and stay healthy, and we are all here to help support you and get you into a better position to prevent your falls. Thanks for listening. Have a good day.